Lustelia, thank you. An expert on historical pandemics is urging people to learn from lessons of the past and take COVID-19 seriously. 9 on your side's Brian Brennan has more on what this professor says has slowed the spread of disease before.
This lab is gathering samples to test for evidence of COVID-19.
We will be using this to see if we can find, again, trace evidence of the genetic material on surfaces that people are touching.
Michael Werby is the department head of ecology at the University of Arizona and an expert on pandemics. He led a study on the Spanish flu, a virus that killed 20 to 50 million people about 100 years ago.
This outbreak, I don't think is going to look quite that bad, but it is looking like a really serious outbreak.
Werby says the coronavirus is very different from the influenza virus that broke out in 1918. Young adults were hit the hardest then, but the coronavirus is more deadly among older patients. But Werby says still he doesn't want people to be complacent.
This is much more serious than a bad flu. This has the capacity to kill many more people than die even in the most severe seasonal influenza years.
Werby says important lessons were learned in 1918. Cities that imposed social distancing measures were able to slow the spread and give healthcare systems a chance to respond.
They had a much better time of it, in part because they, again, were able to spread those cases out over a longer haul. And I think this is going to be really important for this pandemic.
Werby says the same age-old methods protect from infectious disease. Quarantine the sick, limit exposure, and wash your hands. Brian Brennan, KGUN 9 on your side.